നമസ്കാരം. ആശ റേഡിയോ ആരോഗ്യത്തിൽ അല്പകാര്യം ഹെൽത്ത് സെഗ്മെന്റിലേക്ക് ഏവർക്കും സ്വാഗതം. ഒരു ചെറിയ ഇടവേളയ്ക്ക് ശേഷമാണ് ആരോഗ്യത്തിൽ അല്പകാര്യം ഹെൽത്ത് സെഗ്മെന്റുമായിട്ട് ഞാനിപ്പോൾ കടന്നു വരുന്നത്. ഒത്തിരിയേറെ റേഡിയോ സ്റ്റേഷനുകളും ഒത്തിരിയേറെ നവമാധ്യമങ്ങളും അറിവ് നേടാനും പങ്കുവെക്കുവാനും ഒത്തിരിയേറെ ചാനൽസുമുള്ള ഒരു കാലഘട്ടത്തിലാണ് നമ്മളിപ്പോൾ ജീവിച്ചിരിക്കുന്നത്. അപ്പോൾ തന്നെ പലപ്പോഴും എനിക്ക് ആലോചിക്കാറുണ്ട്, ഈ ചെയ്യുന്ന ഹെൽത്ത് സെഗ്മെന്റ് മറ്റുള്ളവർക്ക് പ്രയോജനപ്പെടുമോ എന്നുള്ളത്. ഒത്തിരിയേറെ ഹാർഡ് വർക്കും പ്ലാനിങ്ങും ഒക്കെ ഓരോ സെഗ്മെന്റിന്റെയും പിറകിലുണ്ട്. അപ്പോൾ തന്നെ നമ്മൾ വിചാരിക്കാറുണ്ട്, ഇത് ആൾക്കാർക്ക് മറ്റുള്ളവർ കേൾക്കുന്നുണ്ടോ, ഇത് ആർക്കെങ്കിലും പ്രയോജനപ്പെടാറുണ്ടോ. ഞാൻ ഈ പ്രോഗ്രാം ചെയ്യാൻ തുടങ്ങിയിട്ട് ഏകദേശം 1 വർഷമായി. ഇതിൻ്റെ ഇടയ്ക്ക് ഞാൻ ചെയ്ത ഒരു പ്രോഗ്രാമാണ് ഓട്ടിസത്തെ കുറിച്ച്. ഈ പ്രോഗ്രാം ഓരോ പ്രാവശ്യം മുന്നോട്ട് കൊണ്ടുപോകണമെന്ന് പ്രേരണ നൽകിയ ഒരു സെഗ്മെന്റ് ആയിരുന്നു ഓട്ടിസം സെഗ്മെന്റ്. ആ ഓട്ടിസം സെഗ്മെന്റിന് ശേഷം അമേരിക്കയിൽ തന്നെ ജീവിക്കുന്ന ഒരു അമ്മ, മലയാളിയായ ഒരു അമ്മ എന്നെ വിളിച്ചു പറഞ്ഞു, വളരെയേറെ പ്രയോജനപ്രദമായ ഒരു സെഗ്മെന്റ് ആയിരുന്നു. ഈ അമ്മയ്ക്ക് ഒരു മകനുണ്ട്. ആ മകന് ഓട്ടിസം ഉള്ളതാണ്. പലപ്പോഴും ഒരു സുരക്ഷിതത്വത്തിന്റെ പേരിൽ ഒരു പ്രൊട്ടക്റ്റീവ് ഫിഗറായിട്ട് അവർ പലപ്പോഴും ഈ മകനെ വീട്ടിൽ തന്നെ ആയിരുന്നു കൂടുതലും ഇരുന്നിരുന്നത്. ഈ ഒരു സെഗ്മെന്റിന് ശേഷം അവരുടെ അറിവിനും അവരുടെ വളർച്ചയ്ക്കും വേണ്ടി എന്തുമാത്രം മറ്റുള്ള കാര്യങ്ങൾ, ട്രെയിനിങ് ആയാലും അതിൻ്റെതായ സ്പെഷ്യാലിറ്റി സ്കൂളുകളായാലും അതൊരു നല്ല ഒരു എഡ്യൂക്കേറ്ററിന്റെ കൂടെയുള്ള അവരുടെ പരിശീലനമായാലും ഇത്രയേറെ ഇമ്പോർട്ടൻ്റ് ആണ് എന്നറിഞ്ഞതുകൊണ്ട് തന്നെ ആ അമ്മ ആ കോഴ്സിന് സൈനപ്പ് ചെയ്യുകയും എന്നോട് വിളിച്ച് എന്നെ നന്ദി പറയുകയും ചെയ്തു. അത് പറഞ്ഞു വന്നത് എന്താണെന്ന് വെച്ച് കഴിഞ്ഞാൽ, അറിവ് പങ്കുവെക്കുക, അത് മാത്രമാണ് ഈ ഒരു സെഗ്മെന്റിന്റെ ഉദ്ദേശം. വളരെയേറെ സമകാലിക പ്രസക്തിയുള്ളതും ഒത്തിരിയേറെ ചർച്ച ചെയ്യപ്പെടുന്നതുമായ ഒരു വിഷയമാണ് ഈ മാസം ആശ റേഡിയോ കൊണ്ടുവരുന്നത്. ഇറ്റ്സ് അബൌട്ട് പ്രൈഡ് മന്ത്. June is celebrated as Pride Month. So we have Sam Merchant representing San Antonio Nurses Association here in our studio to discuss about Pride Month. My goal with this segment is bring awareness. So welcome to the show, Sam Merchant.
Thank you.
So I'm so happy to have you with us in this month, and it's an honor to present this topic and bring among the community. So as I told you in the past, most of our listeners and also viewers through our social media is South Asian community. So I am representing as a part of this community. I felt like awareness is the first thing to do. So I'm having you here, and I'm so glad you are here to do this topic with us. So please introduce yourself, Mr. Shah.
Well, thank you, Anila. This is exciting. Firstly, I want to thank Asha Radio for taking this bold and much needed step in helping create this awareness on this Pride Month segment that we are doing today. Thank you for having me at the studio with you, and I am excited to share the knowledge and experiences that I have gathered in the last so many years of learning about this and being part of the LGBTQ plus community. So I'm Sam Merchant. I'm the president for San Antonio Indian Nurses Association, and I'm here representing the LGBTQ plus South Asian community, helping to bring the awareness. I'm also representing National Association of Indian Nurses of America to make sure that all nurses and healthcare professionals improve their competence and knowledge regarding the LGBTQ plus population.
Thank you. That's a very good thought. So as the headline of the topic, Pride Month, I heard 2 words, Pride Month and LGBTQ plus. So explain me, what is Pride Month and what is LGBTQ plus?
So let me answer the second question first. So LGBTQ is nothing but a mnemonic that was created to start including the spectrum of population that we have identified. As the knowledge and understanding and awareness of human sexuality develops and gets built in science, we're able to now add more letters to this mnemonic. Initially, the letters were LGBT, which is lesbian, gay, bisexual, and transgender. These were the folks that were identified through these 4 mnemonics. Now we have various other mnemonics that have been added into the mnemonics of LGBTQ, and that's why we now call it a spectrum. And that's why the representation of the color for the Pride Month or for the LGBTQ community is a rainbow. A rainbow is a mixture of shades and colors, not just those 7 colors in the rainbow. So that actually encompasses the whole LGBTQIA plus community. And now they've added 2S, which is two spirit. And plus basically means really there are communities or there are genders and there are sexuality that we have still not explored, that humans have still not gotten to a point where they've been able to identify. So that plus sign at the end talks about the extra that we might continue to add to the list. As we grow in science, as people come out and come forward and start talking about what that means to be a human, we will actually continue to add those mnemonics. So that's what LGBTQIA, Q is queer, I is intersex, and A is ally. A could be asexual as well. So the best thing for folks is to keep up to date with these mnemonics as they continue to develop. There are a lot of national scientific organizations from in United States and internationally that are actually producing these mnemonics. That's how we get these numbers or names, so as to say. Now, as far as Pride Month is concerned, Pride Month is nothing but a month that is dedicated to the hard work and resilience that LGBTQIA population has gone through in the last decade and a few decades to get to this point. So this month was dedicated to really celebrate and acknowledge the hard work and the dedication that people in the LGBTQ community has put together in terms of laws and policies, in terms of creating equality and rights for every single human being. And so this month is to celebrate those achievements that we have had over the last several years.
So you explained so many things to me. Thank you. Thank you so much, Sam. So while I was preparing this topic itself, I felt how ignorant I myself have is about this topic. I know from the beginning of the humanity, even in the epics, in the Mahabharata, Ramayana, even in the Bible, there have mentions about this LGBTQA+. But we always talk about men's problems, women's problems, kids' problems, teenage problems. We never talked about this one. So I think this evolving, this coming out over the decade itself is a proud thing. And I felt like, past 2-3 years, especially, it is becoming more popular. People are coming out for their rights for equality, to be treated as normal and equal. So what do you think, which are the organizations behind this, like international organizations behind it?
So there is a lot of organizations, I think, internationally, even from a health sector standpoint. CDC and WHO, which are the big healthcare organizations, have started really putting out really material specific to LGBTQ health and gendered health, or gendered medicine, it's called now, in healthcare. And so there are human rights organization also internationally, and here in the United States, Human Rights Campaign, HRC, is a huge organization. I sit on the local board for HRC here in San Antonio, Texas. And we really are the organization that tries to talk about openly and proudly what are the rights of human beings. It's and I know it's the queer community. If you ask them, they might tell you that nobody should be identifying someone as, oh, this is Sam and he's gay. That shouldn't be really the norm. The norm is, you are Anila and I am Sam. You are an individual and I'm an individual. There are things that make me individual, and my gayness or my LGBTQ-ness is part of me. It shouldn't make me feel separate from others. But the organizations like Human Rights Campaign, for example, talk about that as human rights. Let's make sure that when we make policies, when we make laws, when we make decisions, let's make those decisions keeping in mind the LGBTQAI plus population and give them the seat on the table. So Human Rights Campaign is another organization. There are also other organizations that are ally organizations that actually help in bringing the families of LGBTQ population. They are not truly identifying themselves as LGBTQ, but they are allies. They are folks that are saying that we are behind you, we support you, love is love. And so GLAAD, G-L-A-A-D, is a huge organization that is actually an advocacy organization that supports LGBTQ rights. And then in the healthcare sector, there's a huge organization called GLMA, which is a big organization here in the United States that helps in forming healthcare competencies and policies for healthcare professionals so that we can treat these folks when they come to our clinics, when they come to our schools, when they come to our hospitals, we can treat them equally.
That's good. That's good. I mean, that was a great information. So you explained about the families, you explained about community, you have explained about the work situation. We all are from different generations, So my next question was that, how can I help someone to be open-minded about this community, like, LGBTQ community, or considering everyone equal? So we are baby boomers, we are new generations, we are XY generations. So I just want everyone to have one outlook. So how can I make it open-minded?
A very good question, and actually a very tough question to answer, because we as humans in general, especially the South Asian community, we are born and brought up in a certain way. And there is nothing right or wrong about it. It's just the way our culture is and our upbringing is, and things that we are slapped on the hand to say, no, don't do that, or don't see that, or don't say that, or don't think about that, right? So it's growing up. I grew up in India, in Bombay and Pune, and I have had my family that, and my extended family that would always be like, well, that's not what men do, or that's not what women is supposed to do. And so unfortunately, we are grown and bought up through generations of this, and this adds to the trauma of the change that we are trying to create in the people's mind. What my suggestion is that people that are from a generation that are not as open as the other generations are, I find reading books, reading articles, reading newspaper, reading anything that is going to open your mind. So reading literature that would actually try to help you discover and open up to certain possibilities that you never have identified before, or never have thought about before, or heard about before. These are concepts that you are now trying to go outside of your box that was created for you. Your family, your circumstances, your government, your community created these boxes for you, and they want you to stay in these boxes. And so reading is one way that I have been able to come out of those boxes and explore that, wow, there is a world outside of what I see in my immediate surrounding. The second suggestion that I have for folks is traveling. Sometimes when we stay where we are and we've lived where we are for 50, 60, 70 years, we never get out from where we are. We never know that there is a better and a bigger and a different. Sometimes it's not better, but it's different. It's a different world outside of us that we could appreciate. Now, there's two words here that I would like to share, and I want people to understand there is one word called acceptance, and the other one is called tolerance. I think tolerance is the first step, where we say, you know what, like in India, for example, we have all these cultures. We have Buddhists and Muslims and Hindus and Christians, and then we have all these different small sects. We have become tolerant in a way that we live with all these people. They're our friends. We go to their festivals and they come to our festivals, right? That's tolerance. Tolerance basically means that I'm going to tolerate, but I'm not fully committed to what you believe in, right? That's what tolerance is. Maybe tolerance is the first step. The second step is acceptance. Acceptance is where you are truly saying that I'm committed to you. I'm behind you. I support you. I'm proud of you. I still love you despite of your differences. So I think that's what would be my suggestion to the generations that are trying to get out of that cocoon and try to be a butterfly and try to fly out of your box, right? And for other people that are struggling to come out, or people that are really, I shouldn't be saying curious or confused or are not sure who they are, they need to find the right outlet and the right people and mentors that they can talk to, these organizations that we talked about, that they can go to explore their sexuality in the right manner, in the right manner. And for people that are allies, so people like you, for example, that is an ally, our role really is to listen. Our role is to let them be them and let them come out, let them share their stories with you without any prejudice, without any judgment. So maybe these are the initial stages of tolerance, acceptance, and being non-judgmental in our Southeast Asian community.
Exactly. So basically, Sam പറഞ്ഞു വരുന്നത് എന്താണെന്ന് കഴിഞ്ഞാൽ ഓരോ വ്യക്തിയെയും അവരുടെ വ്യക്തിത്വത്തിൽ അംഗീകരിക്കുക, ബഹുമാനിക്കുക, അവരുടെ കേൾക്കാൻ ശ്രമിക്കുക, അവരോട് മറ്റുള്ളവരോട് സംസാരിക്കാൻ ശ്രമിക്കുക. ഞാൻ ഉൾപ്പെടുന്ന സമൂഹത്തിൽ ഇത് ശരി ഇത് തെറ്റ് എന്നുള്ള ഒരു കൺസെപ്റ്റിലാണ് നമ്മൾ നിൽക്കുന്നത്. പക്ഷെ നമുക്ക് തെറ്റായ കാര്യങ്ങൾ അല്ലെങ്കിൽ നമ്മൾക്ക് അറിവില്ലാത്ത കാര്യങ്ങൾ വായിക്കാൻ ശ്രമിക്കുക, മറ്റുള്ളവരിൽ നിന്ന് പഠിക്കാൻ ശ്രമിക്കുക, യാത്ര ചെയ്യുക. യാത്ര ചെയ്യുന്നത് തന്നെ നമ്മുടെ മനസ്സിനെ തുറക്കാനും നമ്മുടെ കാഴ്ചപ്പാടിനെ തന്നെ മാറ്റാനും സഹായിക്കും. നമുക്ക് എല്ലാവർക്കും അറിയാം, നമ്മൾ LGBTQ കമ്മ്യൂണിറ്റിയെ പല പേരിൽ നമ്മൾ വിളിക്കപ്പെടാറുണ്ട്. പക്ഷെ അവരുള്ളിൽ അനുഭവിക്കുന്ന വേദന എന്ന് പറയുന്നത് വളരെയേറെയാണ്. ഇനിയെങ്കിലുമുള്ള തലമുറ, ഇനിയെങ്കിലും നമ്മുടെ അറിവ് വിശാലമാകുന്നിടത്തോളം കാലം, നമ്മുടെ സാധ്യതകൾ വലുതാകുന്നിടത്തോളം കാലം അവരെ കേൾക്കാൻ ശ്രമിക്കുക, അവരുടെ ഇൻഡിവിജ്വാലിറ്റിയെ അംഗീകരിക്കുക, റെസ്പെക്ട് their personality, respect their individuality and treat them equally. So that was a good, like even though it's applicable for all the community, like every person have an individuality, like every person have a personality. So you cannot put them in a norm. Hey, this is the normal, because who creates the normal? Like, so that was a great advice. So you give me also the same thing. What my next question was, if someone is struggling, like to identify who they are, like that individuality, what advice can I give them? So that was the advice you told me. Talk, listen, find the mentors. So Sam, it will be really helpful if you give me the links of this organization so that I can put along with the video. So when I was doing my research and my study regarding this topic before this interview, we have very limited interviews or like topics or discussions among Indians and South Asians. We have, but they are not specifically talking about these things. So let me ask you, at what age, before that, I want to say, I heard about a term called coming out. So at what age this coming out happened?
That's a good question. And, there is no age. I have known folks, that is kids, 3, 4, 5 years of age, that are saying that I think I'm different. And that's how it starts. It starts from the fact that I am not fitting into the norm, the male, the female, and this is how you do things, and that's how you do things. And sometimes that individuality is nothing to do with the sexuality of the kid. It's probably to do with the kid is probably more artistically inclined, or the kid is more inclined towards something that is not part of his identified heteronormative identification, right? That we think that men should be doing sports while women should be doing art and be dressing up and getting married, right? So those are all norms that we have created in the society. These are heteronormative culture that we've created. So for kids, sometimes as early as that age, they're going to see and feel that they're feeling different. A lot of kids that I've heard there's a lot of research going on now in this area, and there's obviously a lot of politics around this as well, because people don't want kids to understand and know these things early on, because they think that the more they hear about this, the more they're going to get influenced. And so now they would want to change their gender, so as to say, which is completely wrong. It's been proven in literature to be wrong. Just by talking about something does not change someone's gender. And I always like to give the example or analogy that I grew up in a very heteronormative culture where men have to be muscular and powerful and not be feminine and not be talking about things that are to do with attraction for a similar sex. That's the culture, that's the literature I read growing up, but I turned out to be gay. So if literature has that much power to change your mind and make you change your gender, then that's commendable to the literature. But that's not how it works. Kids growing up feel internally, and it's called gender dysphoria. That's the word that we use in the medical science. A gender dysphoria is when people feel that their gender that they were born with, so the sex that was assigned to them at birth, either a male sex or a female sex, they don't find themselves internally relating to that sex. And that's called gender dysphoria. And that starts with the thought process of a body image dysphoria, where you have this body that you don't like because you feel like this is not my body. So sometimes it starts way early, and these kids will be very outspoken. If they have a supportive family, they will share these with their parents, that I don't feel like this is my body, right? So sometimes coming out happens as early as those ages. But on the other hand, like for me, I knew that I was gay way early in my life, but I could never put a label or a word to the feelings that I had, to the emotional connections that I was feeling. I could never put name to it. It took me 23 years of my life to come out. So again, some people will take longer. They're late boomers that just could not garner the courage to actually get to a point where they could actually say those words or speak those words, and that's part of our culture. It's because our culture says, oh, don't say gay or don't be feminine or homosexual. The word itself has this negative connotation. So when you want to identify as homosexual, you probably would not use those words for yourself, because you were told around you, your friends, your family, your culture, your religion tells you that that's not the word you use. That's wrong. Right. And we know as early as 2005 to 2006, DSM classification identified homosexuality as a disease also. So I think that adds to the whole idea of, oh, so this is a disease, so I'm not going to tell anybody that I have this disease, so as to say, right? So people don't come out. So to answer your question, coming out, there is no age. I've seen people come out as early for LGBTQAI as a very young age, and parents have been very supportive. And the research says that the faster we put them on hormone therapy, the better it is for their transition. And then I've had people that come out when they're teenagers. Majority of the folks come out when they're teenagers, because that's when all the changes and hormonal changes are happening in the body. And that's when you actually start making friends. You want to get out of your family circle and start mixing with peer culture, because peer is more important during teenage years than family. So then you start exploring and understanding who I am. And so for different people, there was an article that was just published just yesterday, where an 85-year-old woman came out as lesbian at the age of 85. Now, she wrote in the article that she knew that she was lesbian from before, but she never garnered the courage to use those words. And so she has lived a fulfilled life, she says, and she has been happy. And she now is able to let the whole world know that I am not different. I'm not abnormal. I am who I am. Accept me for who I am. So at the age of 85. So again, there are late boomers as well in this world.
I can't imagine this, because I've been on this topic for the past 1 week. Every day I'm learning too much. At a point, I felt so guilty as a part of healthcare worker, how ignorant I am about this topic. To be honest, like you told earlier, like the DSM classification, I don't remember I have learned about this one or about a community like this in the school. I don't think even now in the medical schools it's been discussed. I work in a pediatric hospital. I have kids who came and they said, "Hey, I would like to be addressed like this." So I have part of my viewers and listeners as nurses, doctors. So as a part of that community, as a volunteer, as an advocate for this community, Sam, what is your advice for the healthcare workers when you have a patient like this?
Absolutely. So I'm going to give you two-part answer in this because there is something about the advocacy for these patients. So when these patients come to our organization, some of these patients will openly identify themselves as LGBTQAI. I recently heard a case scenario that happened in my hospital where a patient who was female, so the patient is transgender female. This means she was assigned male sex at birth,
Right.
but now she's identifying themselves as a female. So because she was assigned a male sex at birth, we know that males have prostate, which is a gland just below the bladder, but females don't have prostate. So
Right.
this particular individual who is identifying themselves as trans female, right? Now she's trans female. She dresses up as female. She looks like female. So the doctors assumed from the beginning of care of this particular individual that this person is a female. And so this person comes to the doctor's clinic every year for annual checkup, and the doctors will treat her as a female. Well, at the age of 55, this person develops prostate cancer that goes undiagnosed. They never thought that this person has prostate cancer because they never thought this person has a prostate. So again, this is a simple example, a very, very basic level of example of how care and inequity in healthcare happens because of our assumptions, because we don't have the ability or openness to ask the right questions. So my recommendation, and this is, we can go on and on talking about this in detail, but my recommendation is for healthcare organizations to be open about asking the right question during admission. When the people come into your clinic, when they come into your detention centers, when they come into your hospitals, when they come into your school, whatever the intake area is, make sure that those folks are educated in asking the right question so that we can identify these people appropriately. Another option is to ask them what is their preferred pronouns and what do they identify as. And this might be a very tricky question sometimes for some people to ask because we're not used to it. So it takes a while. It's a growing pain, so as to say, to create any change in an organization. We can start as basic as there and also let the people know from the beginning that we have advocates and we have folks available in this organization that can help you if you have any specific question regarding LGBTQ health. So that is where the organization can be open to sharing who they are, and we are welcoming you in this organization for your healthcare needs. So that's one thing that organizations can do. The second thing that healthcare workers can do, and this is really a big trend going on in the United States now, the medical education and nursing education. A lot of organizations that are educating nurses to create BSN nurses and MSN nurses and doctors, these organizations are actually creating curriculum so that we can actually train doctors on the basics. So it's a 101 basics of LGBTQ plus health, both for nursing and for medicine. San Antonio Indian Nurses Association last year took the bold step, and we created a curriculum to educate our 300 members on this LGBTQ health nursing. What is nurses' responsibility in caring for LGBTQ plus health? So my recommendation is to find these resources. Now find the reputable resources. Harvard, Johns Hopkins, Cleveland, Mayo, they all have good resources on their website. And there are organizations like NAINA, organizations like GLAAD, Human Rights Campaign, GLMA. These are all big organizations that have free resources available for healthcare professionals to educate themselves. And then if you are a healthcare professional that goes to multiple conferences, then you will know that at least there is one or two topics in every single conference where they teach you about LGBTQAI health. And especially the trend now is transgender health, because that is the community that has been left behind, so as to say. Though they are part of the LGBT spectrum, they have not been talked about. So now there is a lot of advocacy going on for transgender health.
That's good. That's good. I mean, considering in general, we need an advocate for this all community in every hospital. I'm a case manager. We always says I'm an advocate for the family, or I'm an advocate for patient. I feel like the common suggestion is like we need a LGBTQA advocate who represent the community so that people will understand. That's a good thought. So we are almost about to wind up our show. You already mentioned that you grew up in India. I'm so happy recently in the Bollywood movies, like this topic was discussed. The two movies, I see that you already saw the Badai Ho,
Yeah.
Badai Ho,
Yeah.
and also other movie. Like last day I saw this Chandigarh Ki Ashiki. So I mean, one was about this gay and lesbian situation, and one was about a transgender situation. So even though it is a sensational topic, I think it is a revolutionary approach in my country.
Yeah. Yeah.
So I know you have a story to say. So what is your story to share with our listeners?
So I really commend the Bollywood, really industry in general for the evolution, right? I remember growing up as a young kid in 1996 when the first movie Fire came out. And that was like a sensation because like, oh no, we don't go and see that movie. And people were throwing eggs and tomatoes and people were boycotting it and all kinds of stuff. So I remember growing up in India in the 90s, when that movie first came out, which was a huge sensation. And now after seeing Badhai Ho, touching on such an important topic of people not wanting to come out and to please their family, they're now trying to be in relationships that they didn't want it to be in the first place. And then on the side, they're continuing to be who they are, which is very common. And we think that it's not common, but here in the United States, it is way more common than we know of. And so it's sad that people have to go to the extreme of choosing to please their parents and their family and their community. There is a saying in India, it's called log kya kahenge, right? That's the biggest thing that causes us to bring ourselves down and try to then assimilate in something that we are not. And that doesn't let us get out of that box that we are talking about. So I'm glad that there is an evolution in the Indian cinema that has happened in this area. My story is a very funny one. And it's funny because today is my dad's birthday. My dad passed away a few years ago. So he's going to be probably watching over me right now while I'm talking about him. So I came out to my parents when I was 23 years old. I was in the United States. I've been here in the United States for a year. I finally garnered the courage that I was talking about to talk that I am gay. And I had a ex-boyfriend at that time, he's ex now. And I said, hey, here is my boyfriend. And so the Skype connection goes down. My parents decided to give me a call because they really don't want to talk on the Skype and let my boyfriend hear what they want to say, right? So they give me a call and they say, and my father, and this is a funny thing, my father is like, so you're saying that you like boys or men? And I'm like, yes. And so my father gave me the suggestion. He's like, let me ask you a question because you've opened the can of worms already. Let me ask you this question because we never talked about sexuality before. I'm from a Muslim family, so we don't talk about those things. And so my father is like, have you had sex with a woman before? And I'm like, Dad, I'm not talking to you about that. That is not something that we discuss. I feel ashamed to even talk to you about that. He's like, well, my dad says, you've already opened the can of worms or telling me that you are gay. So I don't think you should feel ashamed for sharing me what you've done in your life. And at that time, I'm telling you, I'm 23 years old. And I told my dad, no, I've never had sex with a woman before. And so my dad tells me that maybe you should give it a try. And maybe you will change your mind. That's what my dad told me. And I explicitly remember that. And so I was cocky 23-year-old at the time. And I told my dad, so you're telling me that you had sex with a man before marrying my mom? Is that what you're trying to tell? Is that what you did first? So you're giving me that kind of suggestion. So my dad hangs up the phone because he's mad now, right? Mom calls me next time. Mom is crying on the phone and dad is upset. And finally, it took a few months for them to understand what I was trying to tell them, because this was that initial reaction that maybe I've just not explored enough in my life. That's why I've made this decision. And so I told my parents that this is who I am. You either accept, but I wanted to make sure you are the first person that I need to tell, because that is out of my courtesy and my religion and my faith and my love to you, that my parents are the most important people in my life. I want to tell you that I am gay, and this is who I love right now, right? So anyways, I've been married for 9 years. Today actually is also my 9-year anniversary with my husband. We've got 2 dogs, and we have been living a very happy life, supporting each other in each other's careers, and supporting the San Antonio community. So we do a lot of work for the community here in San Antonio and in India. So I'm proud of who I have become in the last 12 years of being here in the United States. And that is in a nutshell who I am. I don't think my sexuality defines me, but my sexuality is an important part of me.
Right. So in short, everybody should be treated equally, irrespective of which sex they are. And I'm so proud of you coming out. I know there are still people who are suffocating to identify who they are and identify, like who I am, like what is my role. So this is something proud, and I'm so happy to share this with my listeners and viewers. And I'm so glad and I'm so thankful to National Association of Indian American Nurses in the United States and also Indian Association of Nurses in Greater Houston to collaborating with San Antonio Nurses Association to bring such a sensitive topic. Like back in my place, my Kerala, recently we had a very controversial situation. So, and I'm so glad. And again, ഈ ഒരു പ്രോഗ്രാമിന്റെ ഉദ്ദേശം എന്ന് വെച്ച് കഴിഞ്ഞാൽ അവയർനെസ് കൊണ്ടുവരിക എന്നുള്ളതാണ്. എത്രത്തോളം എനിക്ക് മലയാളത്തിൽ കൊണ്ടുവരാൻ പറ്റി എന്ന് എനിക്കറിയില്ല. പക്ഷെ ഈ ഒരു വിഷയത്തെ സംബന്ധിച്ചിട്ടുള്ള അറിവ് നേടുക, വായിക്കുക, മറ്റുള്ളവരോട് ചോദിക്കുക, അറിവ് നേടാൻ ശ്രമിക്കുക, നമ്മുടെ കാഴ്ചപ്പാടിനെ കുറച്ചും കൂടെ വിശാലതയോടെ നോക്കിക്കാണുക, യാത്ര ചെയ്യുക, നമ്മൾ കാണുന്നതും ചുറ്റി കാണുന്നതും എല്ലാം എന്തെല്ലാം രീതിയിൽ മാറ്റങ്ങൾ ഉണ്ടെന്ന് നമുക്ക് അറിയാൻ സാധിക്കും. ഇങ്ങനെ ഇതുപോലെയുള്ള മറ്റൊരു ടോപ്പിക്കുമായിട്ട് we will be coming back soon. So if you have any comments or questions regarding this topic, please feel free to contact us. We will put the link of all the associations you kind of mentioned, and you should definitely come back, Sam. Like this is like an ongoing process of bringing awareness to the community. So and I'm so happy to have you, and I will see you in the conference in a few months. Thank you.
Absolutely. Thank you so much.